Is this lockdown working?
So we haven't really got evidence that it's working so far. The north of Ireland, the 6 states of Ireland, counties of Ireland that make up Northern Ireland, have had a decrease in their rate, but they had a prolonged lockdown and earlier on than the rest of Britain. Other areas, the northwest, which still has the second highest rate of infection, is on the decline in terms of its number of cases. Every other region of England remains on the increase. Northeast, Yorkshire, Midlands, particularly high, but actually southwest has the highest rate of increase, and the south of England and London are all increasing in terms of their numbers. So at the moment, there's a steady increase. There's a steady increase, as you say, in deaths, so that there have been more than 4,000 deaths over the last 2 weeks. This last week, 2,878 deaths. The week before, 2,333. And our hospital admissions are again increasing, so that there are 14 to 1,500 admissions a day. And overall in hospital, we've got around 14,000 COVID patients who are admitted solely for the effects of the coronavirus in hospital at the present moment, George. So not evidence as yet of declining numbers, and not really strong evidence even of stagnating numbers. The numbers continue to increase.
And it's going to finish quite soon, the 2nd of December. I think it's scheduled to finish. What will have been achieved by then? Are we just sort of playing for time, waiting for the vaccine?
I mean, if you look at, we've discussed this before, if you look at Neil Ferguson's initial model, the initial strategy of the government very much was herd immunity. And the concept then was simply to stop the huge numbers of cases overwhelming entirely the NHS, so that the lockdowns would be triggered by a certain rate of admission into intensive care, a certain number of people on ventilators, a certain admission rate.